Welcome to Care for All, the podcast where we will be discussing the truth about universal health care, what it is, why it matters, and how it works. My name is Amy Bloomer.
And my name is Kiara Brown.
Together, we will be exploring the universal health care and the profound impact that it could have on America's healthcare system.
We will speak to medical professionals, share real-life stories, and answer any questions that you may have about what universal health care could do for you and your community.
So, join us as we explore the principles, the challenges, and the potential of universal health care.
So what exactly is universal healthcare coverage? According to the World Health Organization, it's about making sure that everyone has access to the full range of quality health services they need without the financial stress. We're talking about everything from health promotions to prevention, treatment, rehab, and even palliative care.
But here's where the U.S. stands out compared to other high-income countries. Unlike those nations with universal health care, we don't have a system like that. Instead, our healthcare relies on a mix of private insurance, employer-sponsored plans, and government programs like Medicare and Medicaid.
In the U.S., a lot of people rely on health insurance to avoid financial trouble during emergencies. Basically, health insurance is like a deal between you, your employer, and an insurance company to help cover medical costs when you need care.
Exactly, so here's how it works. You pay a monthly fee called a premium to the insurance company. But here's the catch. These plans usually don't cover everything. You often end up paying extra out of pocket, like deductibles or co-pays, when you finally use the medical services that you need.
The issue with the system, though, is that not only are there millions of Americans without insurance, the costs for those who do have insurance are rapidly increasing. According to author Rick Myers, who wrote the article Universal Coverage and the American Health System in Crisis Again, one particular alarming consequence of these worsening trends is that healthcare-related problems are one of the leading causes of personal bankruptcy in the United States. Upward of 600,000 individual cases in 1999, or nearly 50% of the total numbers of non-business bankruptcy filings, were traceable to one or more of these problems: lack of insurance, insufficient health insurance, and/or substantial medical bills.
As our economy continues to grow and change, especially after policy changes made during the recent election, the United States is not in a position economically to effectively run on a system where people are expected to pay for all medical expenses and their insurance all on their own.
In order to gain further insight in the effects of our healthcare system, Amy and I interviewed University of Cincinnati's Medical Center social worker, Lisa Bloomer.
Lisa has 17 years of experience working in this field and has experienced many different situations with people from all walks of life. The hospital serves a diverse demographic of people within the tri-state area. When asked the question, how do you think that universal health care would impact the accessibility of care for a lower-income patient, Bloomer responded.
Well, universal health care could impact more than just lower socioeconomic patients. By having universal health care, we could eliminate insurance premiums, maybe co-pays, deductibles, which can be a barrier for many. Another benefit of universal health care would be to remove those financial barriers for everyone and ensure equal care regardless of their income.
Bloomer really drives home an important point. Universal health care isn't just for people with lower incomes. It's something that could benefit everyone. Getting rid of costs like insurance premiums, co-pays, and deductibles would eliminate the financial burdens that often stops people from getting the care that they need and that they deserve. Her experience with patients from all walks of life highlights how vital it is to create a system that truly works for everyone. I can personally relate to this. My little brother is diagnosed with high-functioning autism, and he's already faced countless obstacles, whether it's the school system or his own personal struggles. Some of his services include various forms of medicine and therapy, which goes on a couple days a week. Out of pocket, this would be crazy expensive. But with the help of our insurances, we're able to afford all of this and live comfortably. If we didn't have the help of the insurance companies, there's a good chance we would be under financial strain, and it could possibly delay the essential care that he needs to improve his quality of life.
If universal health care were implemented, it would remove any possible barriers, ensuring that people with autism and other conditions would be able to get the proper care that they need. This is why universal health care is needed, not just for lower-income families, but for all families who have loved ones with complex, ongoing health needs. So now, let's talk about a different perspective, one that's pretty common here in the United States.
Many believe that in these mixed markets, the coexistence of public and private providers naturally give rise to the strategic interactions between them.
This is an interesting point. While the coexistence of public and private providers does create a dynamic market, it also leads to many disparities in accessibility and affordability. Private providers often prioritize profitability, which can result in higher costs for patients and uneven distribution of care.
These dynamics can mean that the lower income individuals and families face extra challenges in receiving the care that they need. Implementing universal health care, though, would level out these disparities by ensuring that everyone, regardless of their income, has access to these essential services.
Plus, universal health care does not just benefit low-income families. It can also take a huge financial burden off of middle-class families, support families during emergencies, and provide stability for those who might lose coverage due to changes in their lives. A universal healthcare system has the potential to create a healthier and a more productive population overall.
So, while mixed markets might offer more choice, they lead to inequality within the healthcare system. Universal healthcare will shift the focus to ensure that quality care will be available to everyone, not just those who can afford it.
Now that you know a little bit about what universal healthcare is and how the American healthcare system works, be sure to stay tuned for our next episode, where Kiara and I will discuss the differences between the United States healthcare system and Taiwan, which is a country with universal healthcare.